Welcome to the Best of Beaver County, presented by St. Barnabas, a weekly segment dedicated to putting the focus on the amazing things and the amazing people behind them in Beaver County. The Best of Beaver County is sponsored by and content is provided by St. Barnabas. The show airs every Thursday from 11 to 11:30 on WBVP, WMBA, 99.3 FM, and Facebook Live. Now, with no further ado, let's welcome host Mike Romai to introduce today's program.
This is Mike Romai, and this is the Best of Beaver County on the St. Barnabas radio station. Because our topic today and the initiative St. Barnabas has started is so very important, we've asked Jeff Bose to return today as we continue our conversation on dementia and memory care. Jeff is a neurological physician's assistant. Jeff, along with Dr. Maroon, has co-authored a book called Fish Oil, The Natural Anti-Inflammatory. Today we'll speak to Jeff on the topic of what a memory care unit is. Jeff, good morning and welcome back.
Hi, Mike. Thank you.
Well, it's so good to have you here once again on this important initiative from St. Barnabas. When we talk about a memory care unit, are there certain criteria that need to be met? And can a home care setting be considered a memory care unit?
Well, it's two good questions, Mike. The first one, a memory care unit is specialized, it's certified, there's professionals, it's a whole host of services that are offered, and it really becomes essential as a condition like Alzheimer's or other dementias progress. But certainly the home can be considered a memory care unit in the sense that care is going on in the home, whether it's by a caregiver, like a family member, or a professional who comes into the house. So where it is located, whether it's an outpatient or inpatient facility, it really, the similar aspects should be maintained, similar care can be obtained. Really, the difference is as a condition like Alzheimer's and other dementias progress, it becomes to a level that a inpatient facility is more important for safety and other reasons, which we'll go over.
Mm-hmm. What are some of the benefits of a home setting, a home or an outpatient setting for dementia and Alzheimer's patient?
Well, I'll give you an example. One of the tipping points that often happens as someone who is entering dementia is a hospitalization. When someone goes into the hospital, they become disoriented, and medications can affect it during hospitalization. And we see this quite often with someone becoming significantly worse when their environment is changed and patterns of life change. So being in your own environment really can maintain a lot of the physical surroundings and the people that are around you and the patterns of life that you're used to, and that behaviorally can maintain someone for a long period of time at home. But there are red flags that we've gone over several times, safety red flags, medications that aren't being taken, hygiene, and other physical conditions that can change that require someone to go into a memory care unit.
So let's flip that around and talk about some of the benefits of the St. Barnabas inpatient memory care unit.
Well, St. Barnabas certainly has a premier memory care unit. We're very fortunate in our community to have 4 different locations, 3 in the North Hills and 1 in the Beaver area. And the idea of a memory care is the time at home that most people spend with progressive dementia is on average about 5 years. So that's a long time of a condition to sort of worsen, but at some point an inpatient cognitive or memory care facility is critical. And I went over a few of those, but the main thing that the memory care can offer that's not offered is the safety issues that come into play as someone's dementia gets older, or worse rather. There's personalized treatment plans that are developed for each resident. The idea of building relationships and again, trying to reestablish patterns and relationships that were existing at home now can exist within the resident's new environment. These personnel are specially trained. There's ongoing and continuous education to keep these folks on the cutting edge. They all have degrees of one sort or the other. So you're receiving the care that's exceptional, and it's 24 hours a day. There's also the concern about other medical conditions, things like diabetes and hypertension, or orthopedic problems like the inability to walk or joints and so on. It can be maintained through therapies and other medical treatments much more readily and much more efficiently in a residence that has memory care. So these are just some of the minor or the smaller improvements that can happen. But the bottom line is that someone that comes into a memory care center that is designated and determined to require it will do better in a residence rather than at someone's home because of all those things together.
Now, is the inpatient in-service facility at St. Barnabas, is it structured for stress reduction?
Well, the stress is really a problem for everybody when it comes to dementia, the caregivers and the person who's suffering. And when you have stress, it just aggravates all situations. It affects sleep. Certainly behavior becomes generally more agitated, and the ability to maintain someone as far as their food and hygiene worsens. So that is really one of the most critical parts of a memory care facility, is to lower the stress, to redevelop patterns of behavior without using medications. And I want to stress that the change away from medications that we saw decades ago, where people were warehoused and placed on very strong antipsychotic medications, is really gone away. There's federal regulations now surrounding it and state regulations, but just as a general humane way of managing someone, it's much better to use behavioral modifications and other ways besides using medications that really had significant side effects.
So there are specific circumstances or warnings that would warrant move from outpatient to in-house.
Yeah, and we did refer to those again as the red flags, and it because there is a caregiver typically at home and the person suffering from dementia, it's both sides of the coin that really have to be going at 100% in the sense that if the caregiver is failing health or unable to maintain the person at home, that brings someone into the idea of a memory care facility. Whether it's safety, the idea of violence, or some other behavioral problem that occurs, the deterioration of other comorbidities or other co-medical conditions like diabetes, or inability to walk, inability to maintain hygiene, bowel or bladder dysfunction, those things are all red flags. And then, the idea that you're not giving up on someone, you've done your best, but it's time to get the professionals involved. And I think that's really one of the reasons that it takes, in some cases, even longer than 5 years for someone to say, the care that I'm giving or my loved one is receiving at home has been great, but it's overextended at this point. It's time to have the memory care professionals get involved.
I can't imagine how difficult that is and how families agonize over that decision.
Well, it's rightly so. I mean, it's a loved one. You've lived with that person, or they're your mother or father or a spouse for many, many years, and there's a bit of denial on both sides in the sense that you remember the days of before, but at some point there is a tipping point. And, it's no one likes to enter into someplace away from their own home, but the idea is to reduplicate the home environment, the home patterns in a facility that is safe, providing good hygiene, good food, maintaining medications that are needed, and quite frankly, stimulating the brain more than can occur if someone's at home, sort of watching TV all the time, which is not a brain stimulator. So the idea of a personalized care pattern a program is very important that a memory care facility can offer.
Oh, it's amazing. Jeff, we've learned over this series with you and Midge that certain types of dementia and the rate of cognitive decline can be pretty aggressive for patients. Could you talk about the staff of the inpatient memory care unit?
Yeah, I mean, it takes all comers, in the sense that a staff has to be versatile. They have to deal with people that are very quiet and withdrawn as far as their cognitive and emotional state. There's some people that lose the ability to speak, and how do you maintain someone's needs when they can't tell you verbally what's happening? So there's a whole spectrum of disabilities that occur with dementia, whether they're cognitive, meaning the ability to think, or memory, or speech, or ability to walk or move or feed yourselves. So the complexity that a person, a professional in a memory care needs to know and respond to is critically important. And it's the whole goal is to maintain the health of the person and to maintain a quality of life. And I think that's really the key, is improving the quality of life.
There must be pretty special people at St. Barnabas.
I think there are, and I know all of them, and I know that they're professionals, and they take it very seriously. And I know there's when you give of yourself, it takes a little of yourself. And I know that certainly during these times of COVID, it's been tough, but they've gone through a lot with both the residents and the families, and I think hopefully, knock on wood, we're over the worst of it.
Yes, we certainly hope so. Jeff, can you tell us about why the program on dementia and memory care at St. Barnabas is so important?
Well, again, they're not available on every street corner. This area certainly is blessed with a lot of memory care units, but the need is increasing every day, every year. As I said earlier, only a certain percentage of people can be at home. It is a larger percent, so about 75 to 80% of people can be maintained for a period of time at home, but that leaves up to 20-some percent or more that require inpatient monitoring and care. And eventually, as our baby boomers get older and the population shifts to an older population, we're talking about tremendous numbers of people. So the need for this kind of specialized care is increasing every year, and we're going to see it expand more and more.
Would you say St. Barnabas has been on the cutting edge of memory care?
Well, I'm glad to say that I think Dr. Maroon and I have had some input in that over the last several years, 5 years to be. In fact, we have been able to introduce certain technologies to help stimulate the residents. Virtual reality was one we've spoke to several times. The idea of taking someone to another place without actually leaving where you're at, virtually going into another world or traveling around the world, virtually visiting different animals and pets, the idea of music therapy and dance therapy and outdoor therapy, all these things are technologies that were really unheard of in the last before 10 years or 5 years ago. So these things are advancing and providing the stimulation in a way that is not anxiety-provoking to someone that has dementia.
Okay, Jeff, we're going to take a short break here, and then we'll return to our conversation. Jeff Boast is our guest, talking about the dementia memory care program at St. Barnabas. I'm Mike Romai from the St. Barnabas radio station, and we will continue our discussion right after this.
They cared for you, and now you're caring for them. Caregiving for a parent experiencing memory loss can be challenging. St. Barnabas Memory Care is here to help. We offer a free in-home consultation for you and your loved one. Why not talk to St. Barnabas Memory Care Specialist today to discuss your individual situation? This no-charge evaluation can assist you with caring for those who have cared for you. Call 724-625-4000 or go to stbarnabasmemorycare.com. St. Barnabas is apart from ordinary.
I'm Mike Romai. You're listening to the Best of Beaver County on the St. Barnabas radio station. Our guest once again this week talking about memory care and the memory care program at St. Barnabas Health System is Jeff Boast. Jeff, we talked last week about red flags. If you're waiting for the breaking point, it doesn't help that much for the at-home caregiver or someone with memory loss. Can you talk a little bit more about those red flags? Because I believe they're pretty important for people to watch out for.
Good question, Mike. I mean, the idea of the ambulance coming up to the house is what comes to my mind when you said about the breaking point, or some other intervention that is unplanned and unanticipated. So, as we've discussed many times, dementia conditions like Alzheimer's are progressive. They worsen over time. So having a plan in place, having a sort of an end game is critical to how to manage someone with dementia. And so these last-minute decisions, last-minute crises that you're describing is something that needs to be avoided. As I said, also, people that come into a hospital environment, it's often due to a crisis, and the environment of a hospital can further disorient and worsen and cause someone to spiral down even further. So avoiding the stress of a crisis is really critical. Having a plan in place is already vetting facilities like St. Barnabas, knowing, calling the 800 or the number that we discussed earlier to get some information, have that available sooner rather than later, because even though we just say it's a progressive decline, generally incrementally, meaning in smaller amounts, things can go south quickly as well. So it is good to have planning and to avoid the crisis that you described.
In the best of all possible worlds, families would get along together and be on the same page when it comes to decision making for a loved one, especially a parent. But that's not always the case. That's not always reality. The St. Barnabas have in the memory care program people that will walk the families through these tough decisions?
Yeah, transitioning coordinators are what you're describing, and that's basically their job, to bring someone to either a realization that, yes, things are going well enough at home and it's safe enough at home and things can continue there, versus the realization that, we're about to go past that tipping point. And that is a person, and one of the reasons for the free evaluation that St. Barnabas is offering, to allow someone to get that information, to learn what are some of the things to look for and be prepared. So the transition of care, both for both parties, both not only for the family to know what's available, but also the facilities to know, what we can offer you and how we can prepare is also critical. So it's a two-way street, and the information that's gathered during that time allows for a smoother transition.
Earlier in the program, Jeff, you made mention of warehousing, which is a tragedy in our society today. How does a family go about figuring what the best care, in-house care is for their loved ones?
Well, I believe you're saying in a facility care. The idea of knowing what's best is vetting the facility, and are the personnel certified? Are they caring, compassionate? Are they empathetic people? Do they have care plans in place? What are the plans for safety? What is the physical structure? How are the meals arranged? What if someone becomes agitated? What is the plans for that? How are they going to specifically cope with my loved one who is unique than anybody else, and continue that same compassion that I had taking care of my loved one for up to 5 years often in many cases. So it's a relationship, and I think I might have said in the past, I'm sure perhaps Midge has said it, it takes up to 6 months in many cases for a family to transition from a home environment to a place like St. Barnabas Memory Care Facility because of all those questions and all those things having to be put in place. So these are generally and ideally not snap decisions.
So it's interesting because you've gone over a couple of them, but how does the memory unit at St. Barnabas excel in things like ensuring safety, increasing and improving the quality of life, the effectiveness of the Mind VR program, just to name a few?
Yeah, well, it starts with the personnel. You have to have the right people in the right places. And I know for a fact, having been there personally and interacted with the staff, they're top-notch. They're all participate nationally in societies like the Alzheimer's Association. They're sought after for their knowledge base. And so that's really where it starts. The physical structures are all within regulations and all safe environments. The food and the other ancillary staff that's available, like therapy and medical treatments and nursing, all these things are there and in place and continually evolving and continually improving. So I can tell you there's a reason that Dr. Maroon and I are affiliated with St. Barnabas for these reasons, is, you know, the idea of cutting-edge treatment and always looking to see what's better, not going on the past laurels, if you will, but always looking to see what we can improve and make better.
Well, I think evolving is a very important word that you mentioned there because, as we know, memory care, Alzheimer's, dementia is constantly evolving. At St. Barnabas, do you keep up with that cutting-edge information? Are you aware and can provide that for the patients when new terminology or new health findings come out? Put that to work at St. Barnabas?
I think that's really the key, and people recognize that with St. Barnabas, is the cutting-edge technology that we've used over the years and introduced. Some work, some doesn't. But the idea of trying things that stimulate the brain, recognizing that prevention is really the key to all treatment related to dementia and Alzheimer's disease. Healthy diet, healthy stimulation of the brain, avoiding stress, getting nutritional things that are needed to help build the brain. All these things have been incorporated only within the last 5 or 6 years because the technology and the science has advanced to that. The use of virtual reality and other technologies is all related to keeping abreast of the latest technologies. And again, you don't want to try technology. There's lots of things that are out there and people are advocating, but you want to vet it, and you want to make sure that this is appropriate for the people that we're dealing with.
Cutting edge at St. Barnabas. Jeff, you yourself, Dr. Maroon, Midge, the memory care unit are constantly upgrading and updating the idea of cognitive stimuli for people with dementia and Alzheimer's. Yeah,
I mean, you cannot put someone in front of a television. We know that now. The brain is like any organ in the body or a muscle. It has to continually be exercised. And this is one of the things we've talked before about, is that COVID has worsened and significantly made Alzheimer's and dementia significantly worse by the lack of stimulation. Depression is much worse during this time of isolation, and that aggravates the cognitive decline as well. So those that have been at St. Barnabas Memory Care Unit have not seen those the side effects of isolation and other things that have gone on. So it really, the idea of keeping the pressure on to look for the future as far as what can be out there to help is really what we're talking about.
Well, we can really see how St. Barnabas is apart from the ordinary. Is there something that we haven't talked about, or we may talk about in future episodes, but is there anything that you would like to mention that I didn't bring up?
Well, one of the things that we may talk about, but I'm not sure, is the idea of involving St. Barnabas is involved in research as well, and I think that's important. A facility that's looking to develop new technologies really has to be involved in research in what's happening. And St. Barnabas has been involved in several studies over the years to look at things that are cutting edge and advanced. So being open to that, having the trained personnel and qualified staff to do that is something that has been done and is ongoing. So I think that's another aspect that may not be recognized.
Yeah. It's all so very interesting, and we gain listeners every week, maybe even within the half hour. So if you would, could you go over the program where listeners can get more information and about the initial free consultation? Absolutely,
and this is a fantastic offer in the sense that free home care evaluation. In-home evaluation for memory care is available, whether initially by phone or in a person's home. It's a free evaluation with a trained professional who will discuss all these details that I've gone over the last 7 or 8 sessions, along with what Midge has gone over, what's available, what can be done. And it is a process of discernment. It may take up to 6 months, but at least you'll have some information and where to go. And you can go to the stbarnabasmemorycare.com website or call 724-443-0700. And there'll be someone to help you with those numbers in that location.
I guess perhaps one of the things that we don't get a sense of is how the family members or the caregivers respond to all this. Any particular needs that they ask for that you can put their mind at ease with when they say, yeah, but mom wants to do this or mom doesn't like to do that? Is there anything, requests that they have that come to your mind when it comes to a patient?
Right. Mike, it's a partnership. When you have the person with dementia in your memory care unit, you have the whole family. So it isn't just the individual who comes in, it's the whole family in the sense that they are partnering with you to help care for that loved one. And whether it's certain foods or certain clothing or whatever it might be, that's part of the team. There's also other support groups available for people who his family has memory care loved ones. So there's a whole host of services that are offered to not only the residents' families, but also the communities that surround St. Barnabas, including seminars and lectures, involvement in the Alzheimer's Association and group meetings that are held. So it's not it's not like you're just cut off after someone comes into St. Barnabas Memory Care. You're included into that.
Mm-hmm. Jeff, thank you so much for taking the time to speak with us today. And I know the program will continue. We're going to have more segments on the best of Beaver County, so we look forward to talking with you again next week.
Thank you, sir.
Thank you very much. Jeff Boast from St. Barnabas Health Systems. You've been watching the best of Beaver County from the St. Barnabas radio station. I'm Mike Romai, and we hope that you're learning from these programs and can reach out to St. Barnabas for that free initial consultation to get help for your loved one and your family. Thank you for being with us. We'll talk to you again next week. Stay safe.
They cared for you, and now you're caring for them. Caregiving for a parent experiencing memory loss can be challenging. St. Barnabas Memory Care is here to help. We offer a free in-home consultation for you and your loved one. Why not talk to St. Barnabas Memory Care Specialist today to discuss your individual situation? This no-charge evaluation can assist you with caring for those who have cared for you. Call 724-625-4000 or go to stbarnabasmemorycare.com. St. Barnabas is apart from ordinary.
Thank you for listening to the Best of Beaver County. St. Barnabas is pleased to have provided content and sponsorship for the program. Tune in this Sunday at 11:30 for an encore presentation of today's program on Beaver County Radio. And next Thursday at 11 for another edition of the Best of Beaver County on WBVP, WMBA, and 99.3 FM.